How do you teach medicine, a subject that is very hands-on in a very hands-off way? Before COVID, in one of my last rotations, I spent more than 500 hours on the surgery unit. But during COVID-19, the AAMC issued guidance strongly suggesting medical students not be involved in direct patient care activities. While this approach kept everybody safe, these students are still missing an essential piece of the puzzle: people. Nick Scalzo moved back to Seattle from New York during the pandemic.
Sort of kind of like playing baseball without a bat. There is a rhythm that you get used to in the hospital and just interacting with people face to face, and there's a lot of good value in that and making connections.
Nanisha Chintal, a third-year medical student at New York Medical College, is using a mixture of virtual platforms and Zoom meetings to learn medicine.
It is very different than what we're experiencing in the hospital, but the basics are the same.
Hi. Yes.
Some of these programs simulate what it's like to be in the hospital, from greeting patients to conducting a full physical exam and diagnosis. So I have a patient like I would in the office, right? I can actually get him to follow my finger with his eyes. You see that? His eyes actually track with the finger. But the coronavirus has taken away another hallmark of medical education: doctor's rounds, a traditional practice used to teach students how to brainstorm and come up with a possible diagnosis for a patient. Now rounds have gone remote and look more like this.
Hey, do me a quick favor. How do you guys interpret that PTH? What does it mean to you?
Dr. Gary Stallings, who is leading the virtual rounds and has been teaching at my school for 12 years, sees a few silver linings during this pandemic.
So being able to have students in a much more comfortable, safe environment to be able to present and make mistakes and do it over again without having the worry of a patient getting hurt by it has been fantastic. The students have really made great strides in that. Definitely want to keep that in the future.
The Association of American Medical Colleges expects more than 80% of students nationwide to be back in the hospital by July. In the meantime, as students are sidelined from seeing patients, many of them are looking for extra ways to help out the community, including delivering PPE and helping COVID patients connect with family, to name just a few.
I think will help the students appreciate kind of how much people depend on them in a way they wouldn't have had before, which will carry on for the rest of their career.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.